My name is Tim Maria, host of Digital Health Live at Digital Health Summer Summit. We're just wrapping up today, grabbing the last speakers. You might hear some background noise because we've had an exciting, huge event today. And sometimes the best come in last. So we have Dr. Pierre-Antoine Gourraud, who's assistant professor of translational digital medicine at UCSF. Did I get all that?
That's right. Yeah. I'm actually a geneticist by training. I came to the UCSF Neurology department 5 years ago, working a lot with all the genetics with MS, and we also developed a really cool project called the MS Bioscreen, trying to integrate all the data we've been accumulating over the years to make that actually more useful for all the patients, all multiple sclerosis patients worldwide.
Okay, so it's multiple sclerosis is what you're working on, and then you have a company you're spinning out?
I would say the research project was really, really successful. So we actually spin off a company called Mira Medicine. Mira Medicine.
How do you spell that?
MIRA Medicine, and we can find out about the company at miramedicine.com on the web. And it's also kind of a research project that I've been leading with UCSF at msbioscreen.org. And essentially the idea was to enable the interpretation of each MS patient in the context of longitudinal reference data that we've been working on for the past 10 years.
Let's get right into a demo. Demos are always good to see, and you have some really cool things to take a look at. So and you can talk to it.
It's very simple. What we're doing here is actually showing the data of one patient. Here the trajectory of a patient in blue, in the context of similar or patients with similar characteristics that we have in the database. So essentially, we're using this iPad application to go into our database, find the data for one patient, and then we have algorithm finding the maximum number of patients with similar characteristics to build a reference curve that will help us understanding how the patient is doing. You can think about that as exactly the same way pediatricians are using growth curve to assess the normality of kids' weight when you're looking at the weight and the age of baby at the pediatrician. So the same way your pediatrician going to say, hey, your baby boy is in the top 10% of the big American boys, well, we can look at the data of a patient and say, okay, you are in the top 10% of patient doing very well here. So you're good, the treatment is working very well for you, let's continue with that treatment. And in other situation, you can say, or maybe it's actually you're not doing that well on that treatment. There's other patients that have similar characteristics than you have, and they actually benefit from a different treatment. So we're doing that with all the metrics we have, assessing functional disability for patients, but we're also doing that for eye, brain, and spinal cord imaging, and that's what we are looking at in here. So we apply the same principle. We make the data available, we store that in secure database in the cloud. We can retrieve in an encrypted manner the data, bring that to the iPad, and show the patients how they've been doing, how they're doing compared to others, and eventually how they would be doing in the future given a particular treatment scenario.
So what's the end result that you're trying to achieve here?
So it's actually multiple. It has multiple interests. From the very first start, when we start to introduce that at our MS clinic here at UCSF, we thought that that was a great patient education tool because we can actually see the data from the past 10 years. That's something that is very difficult to achieve even through the most advanced electronic medical record systems. It's also helping the clinicians to accelerate his thinking about how the patient is doing, how he's doing compared to others, because we're helping such sort of thinking through the health IT we've been developing. So it's really a software platform that actually helps decision making and support decision making. So we're not trying to start something like a clinical trial to see what it's actually changing really in a quantified way. Are we changing more therapy? Are we maintaining more other ones? It's really how do we sustain decision making with real data from the best research that have been done in the field.
Awesome. Very cool. Well, that's what happens at the Digital Health Summer Summit is you get to see some of the most cutting edge people and really results that are making the future of digital medicine. So what's next for you and how do people reach you?
So, we're actively expanding the project. We're trying to, our dream really would be that this kind of application would be available for any patient that have MS in the world, so that they can interpret their data in the context of the best reference. So longitudinal reference cohort, like the one we've been maintaining at UCSF, but also individual level data from clinical trials and large database from electronic medical record system. So we're actively trying to deploy that. That's what the company will be doing. And also we're working on new algorithm that will make very, very effective prediction and recommendation tools.
Wow. Okay. Well, that's Pierre-Antoine, UCSF. Look forward to coming up to the lab and checking this out in person soon.
Thank you very much, Tim.